Let's now bring in DENOSA Free State Provincial Chairperson Thibogang Thole to just weigh in on this incident and give us a sense of what the impact of the work of the hospital is going forward. Thank you so much for your time. So while investigations are ongoing, some reports indicate that the blaze at the hospital was caused by a lit cigarette, that was left unattended just outside the ward. Your reaction as DENOSA around this particular incident, especially affecting one of the more vulnerable parts of the hospital, the pediatric ward?
Good afternoon to you and listeners and viewers of your radio. I think as DENOSA, we are going to wait until the final report is given to us regarding the investigations. We will wait for that process to be completed. However, we are having a concern into the impact of this fire that broke at the National District Hospital, in that nurses or our members had to be allocated to other facilities. That in itself causes the inconvenience of being transported from where their residence place to the place of work. Number two, what we are picking is that we are told that the health and safety committee structure, it's not functional. It's not even there at the institution, which could have picked up all these problems before they take place. For instance, the investigation, as you are highlighting it, of being caused by a cigarette. In any facility of health, we are not expecting anybody, including the patient, the staff, to smoke. But however, you will have to provide them with a designated area of smoking. So if that is not done, it means that committee should have put all this in place to prevent this fire broke that took place there. So we are pleading with the Department of Health to ensure that such structures of health and safety, because they are legislative imperative, must be in place, not only in the facility that is affected today, but we must make sure as the department that the health and safety committees are in place in all the facilities in the Free State. I'm raising this issue because only this...
Let me come in there before we start speaking about, solution modes and what the department can do, just based again on this very fire. Thankfully, no one was injured and patients were evacuated. Can you describe just how big an area of the hospital this is, that we're now talking about, as we, of course, understand that it will remain closed until all investigations are concluded? We'll then come back to how the Department of Health can then address some of the systemic issues, particularly when it deals with major parts of the hospital.
As I indicated earlier on, we don't know the extent of the damage caused by this fire. We are aware that it's only three wards that are affected, level 1 and level 2, and the pediatric ward that is close to it. And that has affected the total number that has been allocated to other facilities.
Okay. And in as far as the way in which, some issues around the way management, has addressed, particularly as you point out, just safety issues, what are your concerns?
It is a concern because it is a legislative imperative to have such committees being in place. Because once that committees are in place, when you do the inspections as a committee, you will then pick out that you don't have a designated area for smoking for the employees and even the patients.
That's exactly what I was going to get to. This obviously, and as you rightfully point out, the investigations are still ongoing. So one would imagine then, following the conclusion of that investigation, one of the first things we would like to see is perhaps safer zones for such practices, especially because we are talking about hospitals in this regard.
Yes, indeed. And the other thing that I think it's important for us as the DENOSA to point out is that in such incident, the staff and the entire workforce of the hospital, because they are emotionally and psychologically affected, they must be taken immediately into a psychosocial support to prepare them to cope with the incident that has happened.
And in as far as your workers are concerned, I mean, we know, because we're told that this is affecting 2 levels within that particular ward. How are they doing? And I mean, what's their mental state at this present time? We do understand, of course, this was a massive evacuation, 83 people having to be evacuated at also an astronomically fast pace, I would imagine.
When speaking to them, our members there, they are really emotionally and psychologically affected. And that is why I'm raising that we should immediately be taking them for psychosocial support so that they can be able to cope with the situation.
Thank you so much, Mr. Thole, for your time and coming on to the program. Of course, that was DENOSA's Thibogang Thole, just speaking to us there around that particular fire at the National Hospital in Bloemfontein.